Hello and welcome to the lecture series of the European Medical Laser Association. Today we will talk about the mechanisms. There you go. So I'm gonna go to the lecture. We will see to talk about the mechanism of laser therapy. We all know the photons and how that went from Einstein to propose the phenomenon of stimulated emission of photons. But only years after, it was one man called Theodor Neumann, who took the theory of Einstein, put it in the device, and he invented the lasers. 2 years later, a young chap from South Africa, Isaac Kaplan, took the lasers and transformed them into the first unit of laser in medicine used in oral buccal-maxillofacial surgery. First, he tested on dogs and then put it directly in buccal-maxillofacial surgery, and he became the father of laser medicine. And then, 5 years after that, Professor Mester said, no, this is not good, and I'm going to prove it. And he took the laser, he did a test, and he found out the laser treated mice, they got exposed to low level of irradiation. He was thinking that he will prove cancer, but no, he proved the irradiated laser treated mice got better biological constants, better hair growth, and he didn't know what happened, what are the mechanisms, until in the 80s when Professor Tina Carey came and described the cell activation and cell retardation. Then some years later we went to lecture in Laser Florence and in Japan, and with all that lovely, fantastic group, we decided to do more and more of interaction, and we learned from each other to prove and to explain what happened in photobiomodulation. And then we met again all around the world, and I lectured since 2000. I was just a young researcher by then. In 1999, it was my first lecture with EMLA. In 2002, I won the Best Paper Award, and there we are in 2005 in International Phototherapy Association meeting in Japan. Unfortunately, some of the pioneers of laser therapy, they're not longer with us. Samuel Lova died 2 years ago, and Mary Dyson does not travel and lecture anymore. What a loss. So, let's see the tissue penetration. So we have all kinds of lasers invented. CO2, the first one used by Isaac Kaplan, and then erbium, ruby, alexandrite, neodymium, and we have the one with diode that is used for infrared and red to be used. You see the depth of penetration of the diode. It goes up to 6 centimeters, 600 millimeters. And how we use it? We touch the skin, and we have an effect inside. On the machine, we can measure how deep into the tissue we want to go. So for the bones of the maxillary or for temporomandibular joint, let's say we need about 30 millimeters. And then for pain relief, we need 1 joules, and we measure the dose. The dose is very important. And as you see, we have the depth of penetration. So when we use the infrared laser, the light doesn't show it's infrared, it's transparent. That's why it can act even on the pulmonary system during COVID. So because this anti-inflammatory treatment at a distance for safety, we never took, oh, is that work? But if we put it on the eyes, we can cause trouble on the eyes, so we don't do that. You see, we never do, is that work? No, because it's transparent and it can irradiate, and we never put it on the thyroid. And also in the room where we operate, we don't have shiny, reflective, because we scatter and react and we do laser treatment somewhere else, mostly in somebody's eyes. And glasses are very important. So the goggles that we have, they have to have the exact use on the what nanometers, what frequency the handpiece is. If you see here, is 830 nanometers. This is for infrared. Where is the infrared goes? It is from about 700 to about 950,000. My machines that I use since 30 years ago are 630 to 830. So 850 is my star that I really like. Let's go to the spectrum of light. So we have the spectrum of light, we have heat, microwaves, all down to X-ray and cell damage. And where are we in photobiomodulation laser therapy? We are visible light and infrared, right there. Let's see the spectrum of light just like this. So we see how the laser therapy, the photobiomodulation act on hemoglobin, melanin, and water. And we see how the hemoglobin is activated by the laser at 630 nanometer and at 830, and then a very good activation for 910. Lots of research on that, but I don't have that machine. 400 also something have a peak, and that is very good to be used on to treat implants. Also, what it does, it stimulates the water and kills bacteria. So we have the inhibit effect and stimulation effect. We can use it with a handpiece. We have this handpiece, and we can use it with this handpiece to treat interdental area on the papilla, to go even on the bow, to use in the ear, to use intravaginal, depends on which of the protocols and for each domain of medical field. So creating the protocol, what did we do? We have the protocol used for irradiation. So for the infrared irradiation, interdental, we use 2 joules up to 6 joules a day, scanning the entire area. And then we have individualized treatment depending on the patient. So what did we find? For example, for inflammation, we found that before we studied the blood and after, we see how the inflammation is gone, all the elements of the blood are better. We see all in the benefit of laser therapy use. The effects, anti-inflammatory effects, are visible before and after. So then, what are the mechanisms? We have a signaling effect from the cell to the body, the signaling effect. So then we have primary effect into the oxygen, getting increase the oxygen ROS and into the ATP. Secondary effect, signaling the calcium of the cell, secretion of growth factor, activating enzymes, and then tertiary effect. Where does it go? Goes to the nerve conduction, serotonin, and then on the other side goes to neutrophils, fibroblasts, macrophage, endothelial cells to get to tissue repair and regeneration. On the other side, it goes to stimulate the protein C reactive fibers, the soldiers of the body, interleukin, and that will remove the inflammation, make pain relief. And from that, we got the effects of photobiomodulation. So from the cell, the tissue, the effect is from the ATP to cytochrome C oxidase, to transport of electrons into mitochondria, then the repair on the cell and the tissue. So clinical effects, we have tissue repair, inflammation, analgesia, local and general. ATP does the regulation, ROS redox state dependent, that's the modulation. So the signal selling goes to cause all these soldiers of the body to react, to cause reduced inflammation, and if there's no more inflammation, then we have reduced pain and we have tissue regeneration, nerve regeneration. So then we got all those effects. Stop bleeding, hemostasis, immediate effect, anti-inflammatory, pain relief, stimulation of circulation, edema reduction, enzyme activity, protein synthesis, cellular growth, differentiation, phagocytosis, collagen synthesis. I am an example. Look at me. I am 51. You wouldn't tell, right? That's because all my life I used the laser. And as using the laser, it scatters and causes this regeneration and collagen synthesis of my skin. And then we have also a systemic effect through the immune system, nervous system, and through the lymphatic system. So we had cases when we treated mucomaxillofacial periodontal chronic disease, and we got the articulation treated, the blood pressure regulated, and no more acne. The dose, so it's joules per centimeter square. But Mary Dyson said it's not laser, it's phaser, patient amplification of simulation emission of irradiation, because we have to calculate the tissue exterior, then the skin, mucoses, blood vessels, bone, ligaments. So how we have the absorption? We have either scatter when the treatment goes and reflects and doesn't go anywhere. Either we have absorption of the light into the tissue, that's what we want. We have the tissue goes through the body and that's it, or scatter and X goes anywhere. Lasers are the replacement of NSAIDs, ibuprofen, Tylenol, paracetamol, you call it. NSAIDs inhibit tendon to bone healing. NSAIDs, ibuprofen, can do 70% damage to the immunity system. Inhibit and cause risk failure is the 15th biggest cause of death in the United States, and raised erectile dysfunction. Also, laser is more cost effective, doesn't have side effects, and is cheap. So there you go again. I remind you the knowledge of mechanisms of LLT, low-level laser therapy, tissue repair, inflammation, analgesia. In short term is inflammation, reduce pain, and stop bleeding. In long term, tissue repair and bone regeneration. Laser safety. Laser in all devices have to be looked at the wavelength and to protect the goggles and protect the thyroid and protect the baby's fetus, and make sure in the room everybody have goggles, and make sure in the room they're not reflective things. Also at the end we have to have this panel. Good. Laser regulator factors. There you know, be careful what power you use and the dose. So, as I told you, you never do with the laser to the eye. In conclusion, laser safety, immediate effects. It goes no more bleeding, pain reduced or completely out, no post-surgery complications, no inflammation and so on, and then very good results obtained at the diabetic patients. Recurrence is low. For long-term effect, complete reduction of scar, metabolic regulation of the patient, fixation of teeth, and reduction of scars. Pain relief, stimulation of circulation, edema, enzymatic activity, they're all good effects from the laser therapy. NASA, FDA, they started to do research in 1998 to conduct wound healing in the space, and then in 1999, US military regenerate nerve research started. In 2002, 2003, Glenn Calder sent an email saying, our days will come, our days will come. Here we are 20 years later. This is still new and more research is to be made. But lots of research. Yesterday I published on ResearchGate, I placed 2 of my articles, and there it is, the book that we published in 2007 in Switzerland. These are my students. Namaste, Namaskaram at PMS College for Advanced Research in Kerala, India. I say hello to my students from NYU that are now big doctors, and I'm so proud. There it is, one example. So from the spine, in at doing treatment at a distance, we managed to do nerve regeneration by the spinal cord. So in all treatment, the bleeding time is in the benefit of the laser treated group. For the neck pain, we found in the benefit of the laser treated group. bleeding time on all types of patients with toxicity from liver and kidney, diabetes, and osteoporosis. Pain relief, we did a patient journal. We see that C fibers, they help to reduce and cause analgesia. On pain relief, it happened to all type of patients. Inflammatory system, we see how it reduces inflammation, and then we see all kinds of types of lasers we have. Take that big scary laser away. Should that be the sign in front of the surgery? No, this sign should be in front of each of our surgeries. And then goggles at the door, so everybody in the room gets the goggles. Is this laser like a big scary thing that we need to know? Oh, take that thing away, it will kill me. Is it just like a weapon and cause trouble? Let me remind you that every year we need holiday, we go to the sea. As much as we have a little bit money for holiday, we'll go to the sea. Why? Because the sun is good for us, but the laser is exactly the sun concentrated into this laser beam without the side effects of the sun, without the bad X-rays, without the nocive rays. It's just the good wavelength that we want, monitor and focused, coherent into this lovely machine. So then we have Isaac Kaplan, Mayman, Einstein, Menster, Tina Carew, and me, silly little old me, meeting Isaac Kaplan in many conferences. And one time I asked him for a life advice, and he said, take good care of yourself. Because if you do take good care of yourself, then you're empowered to take care of the others. First of all, take good care of yourself. Then time passes and we try to measure and monitor and see what not and research. Remember, photobiomodulation is a help to the classic medicine. It's not a replacement. We have all kinds of machines, erbium-YAG, neodymium-YAG, and all kinds of application. CO2 is the first one used. It's still one of the most popular. Argon laser is used too. Neodymium-YAG is a star, erbium-YAG as well. So the patients and the doctors, they say, too expensive, it's difficult to learn, it's not safe, it's not better than traditional. But yes it is, yes it is, yes it is. Let's be brave and use it, shall we? So, photon made by Einstein, when an electron moves from a higher energy to a lower, a photon that is a particle of light is emitted. Light emitted this way and moved is called irradiation. The distance between two emission of photons is called wavelength. We have chaotic light caused by the light bulb, and we have coherent light caused by the laser, polychromatic light caused by the light bulb, and monochromatic light caused by the laser. In a neodymium laser, we have this flash lamp pump source, high reflective mirror, and then partially reflective mirror to cause this laser output. Neodymium is a crystal medium. Then we have a strobe light, solid state crystal, we have gas, and the electrical current, that is the diode that I'm using. all more or less they can go and create the same effect. Monochromatic light, collimated and coherent. This is the light amplification, stimulation, emission of radiation. Laser. Laser frequency. Asimer, 193 nanometers, all the way to CO2, the 10,600 nanometers. The photobiomodulation is cold, is safe, doesn't hurt, no heat, and is in between 400 all the way to 1064 into visible, that's the visible spectrum, and infrared. It's not a weapon to be afraid of. So, the pulse. We have continuous use of light and pulse. Continuous for pain relief and pulse for reducing inflammation. Generally, neodymium-YAG, 2% of time, reduce no thermal effects on tissue, but we can use it to cut the same. So there are some lasers that they have small wavelength that gives this biostimulation and they can cut. And at the margins of that cut, it is biostimulation. Pulse duration can provide initial benefits, ablation tissue and hemostasis, and then photobiomodulation. The light is absorbed, reflected, scattered, and transmitted. Remember, on spectrum of light, how we have different absorption of hemoglobin, melatonin, melanin, and water. Remember, the depth of penetration is very important. Remember, in infrared, we have an effect non-invasive inside the tissue. When we penetrate the tissue, short exposure is no thermal damage. Long exposure, we have thermal damage with hot lasers. With the infrared photobiomodulation lasers, it's cold, doesn't cause any damage. And there you go, there you go. Remember, laser, what does that mean? Light, amplification, stimulation, emission of irradiation. So let's see, for the gas, there is a mirror and a power source and another mirror and electrodes, and then the electrons, they meet and cause this photon, and then the photon emits light. And we can focus that and modulate to cause treatment. CO2, fiber optic, and treatment. Laser types, we have soft lasers and hard lasers. Argon skimmer, neodymium-YAG, erbium-YAG, CO2. For photobiomodulation, we have desktop lasers, focus light, and we also have this LED with unorganized light that also does photobiomodulation laser therapy. So which types of wavelength we have? We have the ordinary light of the sun and light bulb. We have laser light, which is monochromatic, focused, one line beam. So we use it and we get treatment exactly when we want, exactly where we want. And then we have the LED non-coherent light that does this laser therapy, physiotherapy, light emission, which is non-coherent. Then we have inflammation, tissue repair, analgesia, and bone recovery. It depends on which class. We have class 1, class 2, class 3, class 3B, and class 4. Laser therapy is in class 3B. So when you see a class 3B and you look at the same machine, Oh, you see 830. Maximum power, 400 milliwatts. Then what do you know it is? Which in the spectrum of light? Which one is it? I know. All of you say in chorus, infrared. Why? Because if we look on the spectrum of light, we see visible is from 400 up to 759, and infrared is from 700 and onward, right? And when we are most used to use photobiomodulation at 830, 910, and 1064 with 1 joule, 16 joules, 20 joules maximum, and so on. So there you go. The dose. We calculate the dose. This is calculated by Tinakaru. Inflammation, reduction and regeneration. Stimulation and inhibition. Stimulation and inhibition. It's the 3D model of laser therapy, photobiomodulation, where we get the Anders island of dose sweet spot. So we have this dosage and we cause this stimulation and then inhibition. So when we treat, we have at the beginning, we have the focus, and you see on the body, on the spinal nerve, how you have the reduction, the irradiation, and how the rays penetrate the tissue and arrive on the spinal cord to treat. Where do we use this laser therapy? We use it on all the fields of medicine. You enter in the hospital, you can use it in the emergency room, auditory, respiratory, dermatology, chronic pain, geriatric, fertility, diabetes, ear, nose, and throat, gastroenterology, gynecology, you name it. Adverse reaction doesn't exist. Just don't put it directly on the eyes. It might damage the retina. Don't put it on the thyroid because we don't know the effect if it stimulates the thyroid. And don't put it on the fetus as well. We don't know the effects. This is a sign that have to be placed in front of a unit where the laser is used. And together with the sign, you also have to have glasses with the mention of the wavelength. So the glasses that you have to place on the eyes, they have the wavelength. Diode lasers are some of my favorites for photobiomodulation. FDA cleared all types of lasers for use in medicine. The first were used for photobiomodulation for pain relief. In the oral mucositis, we can use scattering the area in the external space or at the distance facing the gums with red and infrared lasers. It can be done at home by the patient directly with the topic use of propolis B liquid before. Brushing the teeth is very important. After every single meal, use the mouthwash. A Q-tip with propolis on the itch, papilla, and then photobiomodulation. Promise in 3 days the bleeding stop. Then we have the incidence of mucositis on the hematopoietic stem cell transplant patients got to reduce and almost zero in the laser treated patients. We see how the steroid can be avoided because cortisone inhibits tissue repair, and you see how a laser treated wound compares to a steroid treated wound with the benefit of the laser. You see a test on the heart, how the after infarctus on myocard we have regeneration. You see on the spinal cord injury, chronic Achilles tendon, and we talked already how the effect of laser is much better compared to the NSAIDs. Other applications on the temporomandibular joint, inflammation reduction to repair of the joint, peripheral nerve injuries into the benefit of the laser, ankle sprain, neck pain again, anti-inflammatory drugs can be replaced with photobiomodulation, and also in temporomandibular joint trismus, the use of laser therapy makes relaxation and TMJ treatment. Neck pain, chronic neuropathic pain, muscular damage, knee pain, and articulation so difficult to treat can benefit of the physiotherapy or photobiomodulation. Varicosity with the formation of the ligaments and so on, and fractures. There it is, a non-union fracture healed with LLLT. So during the years, LLLT got all kinds of names: cold laser therapy, low-level therapy, photobiomodulation, laser biostimulation. It's all the same thing. There you go. We continue to tell you thank you so much, and I hope you enjoyed the lecture. Lots of love. Thank you. And please visit our website www.emla.info for more information and to see this lecture and all the other lectures we have. God bless and stay out of trouble. Lots of love. Enjoy life. Thank you.